My name is Greg Koshell and I'm 52 years old. I started having some chest pains and then I started having pains in my left shoulder. And at that time I knew something was up, but then it started going down my left arm and tingling started in my left hand. And at that point I told my wife, I said, you need to get me to the emergency room. I said, because something is not right. And as we got to the emergency room, she told them that she thought maybe I was having a heart attack. Well, as I got in the emergency room, they did tell me I was having a massive heart attack. They did get me under control, and they told me I was very fortunate because I had about 2 minutes to 60 minutes max of living. In other words, they told me I was a walking time bomb.
Mr. Koshell came into the emergency room with severe chest pain, and his initial electrocardiogram showed that he was having a really big heart attack. We activated the cardiac cath lab. He was taken emergently to the cath lab. He had a complete blockage in the front artery of his heart, which is called the widowmaker, or the left anterior descending artery, and we were successfully able to open that artery up within about 40 minutes of him coming to the emergency room. So it was a rush procedure, an emergency procedure, but he did really well at the end of that.
Dr. Karim Nabala took care of me in the hospital after the surgery of doing a follow-up at my bedside. He was very upfront and very outspoken, and what I loved about it best, he told me, he was honest. He says, we put a stent in you to save your life, but he says, I'm being honest with you, you are not out of the woodworks yet. A possibility within the next 3 months you could go through a bypass. I was very appreciative of him being up front and all that, and he continued to take care of me from that day on, as he does to this present day.
So Greg came in to the emergency room complaining of severe chest pain, and his initial EKG that was done showed that he was having a big heart attack. He was taken emergently to the cardiac cath lab, and we found that the main artery running down the front of his heart was completely blocked. That artery is called the left anterior descending artery, or commonly known as the widowmaker. We then placed a stent, opened that artery up, and I think the entire amount of time that it took from the time he got to the emergency room till the time we opened his artery was only 40 minutes.
Dr. Karim Nabala saved my life, and I'm very appreciative for that. And the reason I state that is because ever since they put that stent in me to save my life, and every follow-up that I've had with Dr. Karim Nabala, he has tested me through tests in times that I wasn't feeling good or tired. He's ran the stress tests and the heart caths. And by him doing this, he has found more blockage in my heart that has occurred, and he has taken the proper steps to be able to open up them blockages through medication and through a bypass.
So prevention of heart attacks is a good question, because I get asked that all the time. I have a lot of patients who come to me saying, my brother had a heart attack, or my father just had a cardiac event, and what do I need to do to prevent this from happening to me? And so there's very well established guidelines as to what your risk for a heart attack is, and those guidelines are based on certain risk factors that you have, which can be modified. For example, smoking increases your risk of a heart attack, being overweight, or eating unhealthy foods increases your risk of a heart attack. At the same time, you have certain risk factors that we can't change, and the fact is, if you have a strong family history of your brother and your uncle and your father of having had heart attacks at early ages, that's something that you're going to live with, and that's something that we cannot change. But the best way of preventing heart attacks is to change those modifiable risk factors. Don't smoke, maintain a healthy weight, eat healthy, exercise on a regular basis, keep good control of your blood sugars if you're diabetic, good control of your blood pressures if you have hypertension, and more importantly, know what your cholesterol is and discuss with your doctor if you need to be on a medication to reduce your cholesterol, because that has been shown to reduce your risk of heart attacks.